So why haven't Canadians embraced syncope units? Well, the answer to that question really comes out of the rationale for syncope units. And the three main reasons, the critical areas that we're trying to address with syncope units are: one, the high rates of mis or underdiagnosis of syncope; two, the high admission rates; and three, the high costs. So all three of these lead to inefficient and ineffective care. And in Canada, when you look at the data for these three areas, what you find is this: that our admission rates run about 12 to 15%, whereas in other countries, this varies at anywhere from about 30% up to 85%, so significantly lower. And these are trends in hospitalization that we've seen over 10 years of time, so it's not just one measure. The second is looking at whether syncope units reduce outcomes. One of those measures is readmissions to the hospital, and they should be less than 5%. And if you look at our national database, we find that no matter which province that you're looking at, the average readmission rates are less than 5%. So these are two benchmarks that the European Heart Rhythm Association and the European Society of Cardiology has identified as effective measures for how well syncope units work. And as far as costs, because Canadians admit less patients to the hospital, our overall costs are significantly less. So we're looking at estimates in the several hundreds of millions of Canadian dollars, whereas in the US or in Italy, this is in the billions of dollars. So in terms of a cost benchmark, I think what's great is that Canadians now have data. So if we come up with interventions, we can measure the effectiveness, but whether 20% is the most accurate or most significant benchmark for our country has yet to be determined.